For information and entertainment purposes only, not intended to be construed as medical advice. Consult your provider.
How long does a dental implant last after you get it?
If under the right scenario, the right hygiene, the right with the technology of today, they can last a lifetime.
Okay.
Great.
They're not 100% successful, but they're getting closer and closer to that 100% mark every day.
That's
you know,
good.
there are risk factors such as diabetes. There can be medications that you take that may play a factor into the process, that may increase your risk level. But the goal is for you to have success implant integrating with the bone and to have a tooth that's on top of it or multiple teeth and for it to last you a lifetime. And today, that's very predictable, though it's not 100% successful.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Sayla, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Today we are talking about dental implants and teeth extractions and all of the amazing technologies there are now so that you can get the teeth that you want and need.
Well, the ones that you need, for
Yes.
your whole life, for chewing your food and everything else.
Smiling.
Yeah, that too, which we do a lot of. We have Dr. Ethan Erwin joining us today, and he is a general and cosmetic dentist at Smile Hot Springs in Central Arkansas. But he's going to be joining us right here in the studio today. I'm so excited to get his input and his expertise.
Me too. Let's bring him in.
Yeah.
Hello, Dr. Erwin.
How's it going, guys?
So
Glad to be here.
great. We're so glad to have you here, Dr. Ethan Erwin. So we're talking about dental implants today and tooth extractions. Let's start with dental implants. Can you define what a dental implant actually is?
So a dental implant is it's a replacement for basically what would have been the tooth root. So it's the bone supports it. It's held within the bone, and the bone actually fuses with it. We call it osseointegration. It's a process. It's changed the lives of many people, and it wasn't discovered that long ago.
How long would you say?
I think that was, I want to say that was late 50s, early 60s. So
That really isn't that long ago.
dental implants, they support a tooth, so it's a replacement for the tooth root, but they support a tooth. Or if you're missing multiple teeth, they can be a support for, multiple teeth. One or more implants could support one or more missing teeth.
Okay.
And that could just be as a fixed prosthetic, or it could be like even a denture that snaps in.
Okay.
And that may sound a little different, but for some people it's a terrific option.
Yeah.
And the main focus with dental implants is to keep people in function. Keep them chewing, because chewing is very important. But also from a cosmetic standpoint, it's a great way to keep your smile bright.
Are they just for missing teeth, the dental implants?
Dental implants, they're just for missing teeth. So there's a scenario where, you may not have lost a tooth, but be a candidate for a dental implant.
Okay.
Oftentimes, in my office, I'll see there's a genetic circumstance that arises where a young person would be missing their adult lateral incisor, and that's fairly common. So and sometimes it's on both sides. Sometimes it's one side.
Oh, wow.
And lower premolars, another tooth that can be missing. Dental implants are a great way to replace that space. Sometimes the orthodontist will get the space where it matches both sides, and then we'll come in with dental implants, place them and restore them. And like I say, I work with my team of surgeons, and it's just it's a terrific way to replace missing teeth.
Wow.
What are some of the other benefits of putting in an implant, a dental implant?
Cosmetic and being able to chew your food. The other thing is preservation of bone. If you lose a tooth, so in a circumstance where, not like the genetic scenario before,
Right.
but if you lose a tooth, if you don't go back and put something there, like a dental implant, you will start to lose bone.
Oh.
And so oftentimes if we're not placing a dental implant immediately when the tooth is extracted, we're grafting the site with a bone graft, and sometimes that's done anyway. So getting it placed as soon as possible is important. Knowing when, it's better to plan with the end in mind.
Okay.
So when I have people come in and just because maybe their circumstances don't allow for them to have an implant placed immediately.
So I hope the answer to this next question is a long time. How long does a dental implant last after you get it?
With the technology of today, they can last a lifetime.
Okay.
Great.
They're not 100% successful, but they're getting closer and closer to that 100% mark every day.
That's good.
There are risk factors such as diabetes. There can be medications that you take that may play a factor into the process, that may increase your risk level. But the goal is for you to have success implant integrating with the bone and to have a tooth that's on top of it or multiple teeth and for it to last you a lifetime. And today that's very predictable. Though it's not 100% successful, it's very close.
Yeah.
Can you make it less scary for us? Like, what is
Oh, I
that?
love
Yeah,
that
so
question.
this is
Make
a
it
good
less
question.
scary, especially as you mentioned the technology.
Yes.
And how far it's comes from what they're thinking it's like.
So it does sound aggressive.
It sounds-
Maybe that's the word.
It
It sounds
does,
aggressive.
it
Dental
does.
implant.
Yeah.
It's oftentimes much less painful than having a tooth extracted
Oh, great.
because a tooth has a nerve inside of it, and so you have to deal with that. If you're not sedated when you're having the extraction or the implant placed or the extraction done, that's more traumatic to get the tooth out than it is to place the implant in the bone.
Okay.
The feedback I get is there is a recovery period, but it's pretty straightforward. I mean, it depends. The extraction is the thing. The extractions of the teeth are the thing that usually causes people to have the negative side effects.
I see. Okay. But is the procedure as far as like how many appointments do you go to, and what can you walk us through what the step-by-step of that is?
So it's different for every scenario. So I don't want to give people a sense that you can have a tooth in 3 visits,
Oh, okay.
but you can.
You can.
It's possible.
Oftentimes, it's possible.
Okay.
In some cases, that is the scenario. They come in, tooth's broke, it's extracted that day, implant's placed. They come back 4 months later, and the dentist or the oral surgeon sees that the implant is fused with the bone, and he'll take a little healing cover screw off. We call it a healing abutment, and he'll scan the implant with we call it a scan body, and oftentimes you don't even have to have an impression taken. Some dentists still do impressions. You can do it either way. It depends on which office you go to and what level of technology they have. But that's a painless procedure. The second visit's a painless procedure, and then the tooth is fabricated. So between visits 2 and 3, the tooth is fabricated. And then on visit 3, we deliver the tooth on top of the implant and screw it down.
Wow.
So it can be something as simple as 3 visits, though I don't ever guarantee individuals that that's the scenario.
see.
Because, there are circumstances that arise. But oftentimes there's less involved than most people expect.
When it comes to the dental implant process, and I already feel like I kind of know the answer, it's a case-by-case scenario, but for the most part, talk to us about timeline and recovery. What does that look like from beginning to end?
So I tell people it's a 4 to 10 month process.
Okay.
Wow.
It's something that could be completed in as little as 4 months, but could take as long as 10 months. There's an extremely rare scenario where it takes longer than 10 months, but very unlikely.
Okay.
Dental implants are, you'll bounce back quick.
Okay.
I do.
Yeah, you'll bounce
Yeah,
back.
I want to keep it positive because I don't want people to be scared. I certainly had some anxiety going into it, being completely honest. But once the process was going, and also choosing the right professional for me, choosing the right oral surgeon who understood my anxiety and who had really great bedside manner, which Dr. Erwin, I can tell you also have, with making your patients feel really comfortable, that played such a huge role into how I felt coming in, getting the work done.
Yeah.
Yeah, you need to pick somebody that you're comfortable with
Mm-hmm.
and somebody that's competent. On my end, it's usually education and making sure that patients understand that we need to begin with the end in mind.
Mm-hmm. Mm-hmm.
It's not, a lot of times people think, well, it's not a big deal, I'm just losing this one tooth. Well, if you use that logic for 2 or 3 teeth, now we've got a problem.
Mm-hmm.
And it's good to replace teeth as we lose them,
Yeah.
So that's just something to consider.
That makes sense.
You need to also consider if your teeth are, if you're going to undergo orthodontics,
Mm-hmm.
So if teeth are not where you want them to be, that's something you need to voice with your, your dentist or your oral surgeon, whoever's placing your implant. You need to let them know because, if you're moving teeth, you don't want to put something that doesn't move there. You want to put it there after you've moved
Oh,
the
I
teeth.
see. Okay.
Okay, it is time for Ask the
the
Expert.
Let's do it.
Yeah, this is when our audience gets to ask you questions. They submit these anonymously, and we ask you, our experts. So today, Dr. Erwin, that is you.
Let's
Here's
do
the
it.
first one.
I'm ready.
Okay, I can tell. All right. I have a friend who had their wisdom teeth removed, and the dentist left the holes where the teeth were open to heal and close naturally. I'm getting my wisdom teeth out soon and want to know if I should expect this and if it's safe.
In short, oftentimes it's left open.
Okay.
Okay.
Sometimes it is closed. It depends on the scenario.
Hmm.
But if there was minimal trauma in the extraction, and oftentimes it's not necessary to completely have the tissue covering the extraction site because a blood clot will form inside that where the tooth was removed. Another thing, we wouldn't necessarily bone graft wisdom teeth, but if you're having a different tooth removed in the mouth that's not a wisdom tooth, a bone graft is usually placed if it's removed, and we don't place an implant immediately. And the bone graft will help fill in the site. And sometimes there's a plug put on top of that that's biocompatible that helps the tissue heal together.
Okay. This next person asks, is it possible to get a dental implant years after a tooth extraction? Or is there a time limit for optimal results?
Great question.
Great question.
The best time to get a dental implant is immediately.
Okay.
But just because you've been missing a tooth for some period of time does not mean that you're not a potential candidate.
Okay.
So never rule yourself out as a candidate for implants until you've visited with your dentist or oral surgeon.
So there's hope, is what
Yeah.
you're saying.
There's hope. There's hope.
I love that,
Yeah,
Dr.
that's
Erwin.
great.
I love
Yeah,
that.
and we talked about technology, and there's a lot of people that 20 or 30 years ago this wasn't offered to them,
Right.
and now they can afford it and they're asking about it, and man, it can still be an option even 20 to 30 years later.
Right.
Wow.
Good thing they waited for the technology.
They didn't know it was coming. Okay, here's the next question for you, Dr. Erwin. How painful is the dental implant procedure, and what can I expect in terms of recovery and downtime?
If it's a single tooth, minimal recovery. You could be at work the next day if it's not if your job is not physically demanding.
Okay.
It depends though. It depends on how many teeth you're having removed or how many implants are being placed. You may need more time than a day, and if you're having an extensive procedure done with 2 to 4 or even 6 implants, you're probably going to need some time off.
Okay.
And I would say 3 weeks would be a good time frame. Not that you're going to be down that whole time period, but it's good for you to not have excessive expectations for yourself in that window.
As far as the pain question, I have a follow-up question that I have to ask as a fellow redhead.
Okay, let's do it. Let's do it.
Is it true that redheads do not feel pain medication, like that we feel everything?
So it is. This is a good question for me.
For those of you who are just listening and not watching, Dr. Erwin
Yes.
has red hair.
Yes.
It is red. It's true that redheads are more difficult to get numb. Oftentimes they require more anesthetic.
Isn't that crazy?
Yeah, I never heard that.
And I don't know. There has been some research done on it. It is a thing. But you know, it's something to consider. You know, if I'm working on somebody that's a redhead, I think, well, I might need to give them a little more to get them numb. You know,
Wow.
on an anesthesiologist end, it might be different. I'm not an anesthesiologist, but
Right.
but just from a dental perspective, I do think redheads perceive pain more so than
Wow.
than the general population. I don't know if it's that we perceive pain more or if the anesthetic doesn't work as well on us.
Right. Okay.
Thank you for acknowledging that.
Yes, all the redheads feel seen and heard.
This person wants to know, Dr. Erwin, I heard if an adult tooth falls out, you can reattach it by dipping the tooth in milk first. Is that true?
I have never heard this.
Nor have I.
It's a thing.
What?
It actually works.
Well, on a young person,
I know.
there is a scenario where this works. The time and how clean the tooth is and how well it's taken care of, the amount of time that passes before it's placed back plays a big component, and the youthfulness of the patient is also a big deal.
Okay.
The younger you are, the more likely this scenario works out. So it is a scenario where if the tooth is avulsed or lost due to trauma, milk's actually not a bad, you know, it's not a bad product. So you
You're
go
blowing
straight to
our
the
minds right now.
the dentist. I mean, yeah, it's kind of crazy.
Okay.
Go straight to the
There
dentist
is
with your
there
milk
is
tooth.
it is likely that you will wind up if the tooth, and it's not guaranteed that the tooth will will heal back into the site appropriately, but there's a good chance that you'll need a root canal after it heals because the nerve has been, if it's been, if we've lost the tooth due to that reason, it's likely that the nerve is dead. So
Okay.
Oh, got it.
I mean it is dead. So.
It is.
There you go. All right.
Oh, last question. As someone who struggles with anxiety when visiting the dentist, how can I address my fears of dental implant surgery?
This is big.
No, you're not alone. I think a lot of people feel isolated and they feel alone out there. And most people have been through what you've been through or they're going to. And it's sometimes good to just visit with those around you. I mean, there's a lot of people that have been through this process. And I think I think that just hearing it from other people can help with your anxiety. But, people, the process is really not something to be scared of. It's better today than it's ever been. This is the best time to get a dental implant surgery. I wouldn't be alarmed, but I think just don't feel isolated. I think that's gonna be huge. You're not alone, and there's dental professionals. I enjoy taking people from a place of insecurity to a place of confidence, and that's something that I'm here to help with. Like a lot of people that I see, and I get this feedback, they feel, I think they feel judgment, or they feel, just know that you're not alone. Like it happens. We're here to help. And I think finding a good healthcare professional is important as well, because I think that can be good. There's a lot of anxiety reducing measures that we can take on our end, such as sedation, that can help with the process and help you get through that procedure.
And as a patient, you really have to advocate for yourself and tell that to your dental professional. Like, I'm scared. Can you help ease my fears a bit?
Yeah, it's good to say it. It's good to say
say it out
It's good to be
loud.
said.
Yeah.
Let us know. I mean, I have to assume that everybody's got some level of anxiety when I see them. But it's good to know. I mean, it's good for me to hear that. It's good for us to talk about it.
Yeah.
It's good for the patient to feel heard.
Yeah.
It's good for you to be heard and to feel like your practitioner has your concerns in mind as they move forward.
It's been so great having you here today and
Thank you,
educating
guys.
us. Yeah. Is
Yeah,
there
it's been
anything we
awesome.
didn't ask you about dental implants or tooth extractions that you'd want to share with our audience?
I feel like we've covered everything really well. I want people to know that dentistry is worth investing in. You are important, and we have some amazing things to offer people today. And it's just a blessing to be a part of that change. And there are other healthcare professionals out there that are passionate like myself that will help you through this process. So I think that's the only thing that I would just like to reiterate.
We appreciate that, and we appreciate you. Thank you so much,
Yep,
Dr.
thank you
Erwin.
guys.
Dr. Erwin.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
The CareCredit credit card is subject to credit approval. The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because of the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All product, service, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.